What's up, everybody? It's Harris from Sterling Chiropractic, and on this week's session with Donuts with Doc, we're talking about inflammation. So, Doc, what exactly is inflammation?
So inflammation is the body's response to any kind of disruption of tissue or a joint or any kind of disruption in the body. And what happens is the body actually throws in the reserves. It's kind of like throwing in the Marines in a battle. It drops in a whole bunch of white blood cells to help try to rebuild things, especially if it is fighting, say, an infection or any kind of disruption. So it's the body's way of literally helping to support that area and provide some relief, help get away a lot of the destructive material, and help bring in nutrients to the area. The problem is that most of the time, if left untreated, it just kind of sits there and pools in that area. And with more and more inflammation comes more and more pressure.
So, what exactly how do people get inflammation?
Probably in your sense, in your spectrum, most of the time people get those in sports injuries or any kind of an injury. Think of a twisted ankle, think of two knees hitting, say in a soccer game, or even if you're lifting and you rupture something or you tear something. Sometimes those are manifested by or made worse by inflammatory responses.
So, what's the best way to treat this?
Well, I'm a firm believer in the old acronym RICE. So rest, ice, compression, and elevation. First, you want to just take a little bit of time off that area. Obviously, if there is a disruption in that area or an injury of some sort, you want to give it a little time to heal. And that's what any injury needs, is a little bit of time to heal. The I, obviously for ice, is that cool or cryotherapy along that area. And what happens is it actually initiates what's called the hunting reflex. So one of the reasons why I tell people to ice for 20 minutes is because it actually constricts the blood vessels for 5 minutes, dilates the blood vessels for 5 minutes, which acts like a pump to kind of pump that out. And it does that cycle twice. After 20 minutes, the body adapts to that and that hunting reflex dissipates. The compression, the C in RICE, literally intensifies the effects of ice. So what I always tell people, if they're icing an area, make sure that you put the ice on it, but take an ACE bandage or some sort of a support and put it around it to give it more compression on that area. And then finally, E, elevation. You want to get that body part as far above the heart as possible. And that way it actually helps to promote that distribution of fluid back towards the heart, back towards some of the vital organs, and it gets some of the swelling out of there.
Great stuff, Doc. Catch us next week with Donuts with Doc.